In this segment, we're going to be showing you a seated variation of testing first rib motion. First rib motion can be tested for its physiologic component of pump handle motion, or we can go through a non-physiologic motion test relative to a more elevated non-physiologic dysfunction. First test we're going to show you is this non-physiologic elevated posterior rib. If we come down the lateral aspect of the neck into the trapezius muscle, we're going to try to palpate the lateral expression of the transverse process of T1 and then just get a little lateral to that. Sometimes you have to pull back the trap. Some people like to push through the trap. However you feel most comfortable in trying to locate that rib. You can see my fingers, or the pads of my fingertips entering. The rib is actually fairly medially along that short aspect of that angle of that cervicothoracic junction there. If you want to, you can then move your thumbs, if you feel like you have more strength and control with your thumbs over the ribs, and you can push straight down like so and see which rib has more spring, which rib seems to be more elevated or cephalad. Or you can take your metacarpal phalangeal joint of each hand and get that over the rib, and then spring with a little downward movement along the rib to see which one feels more restricted. If you're thinking in terms of an elevated, which is the most common expression of that type of dysfunction, of this non-physiologic dysfunction, sometimes you can just feel and palpate that that rib and the muscles over it are tense. So if this rib on the right, if I met resistance when I'm pushing with the right, and this felt free, and the symptoms were right side, etc., then I might say that he has a posterior elevated rib. And it's probably associated more with a bucket handle aspect of the rib motion, even though that's the least motion expressed by the first rib. The other thing you can do is palpate the posterior aspect of the rib as it articulates with T1, and then reach your hands forward at the anterior clavicular area, at the sternoclavicular junction, and now we're going to change our views here. And now you see that I have the first rib contacted back here, but now I'm going to move into that anterior clavicle, sternoclavicular, find that rib just as it articulates inferiorly, and now I have both the posterior and the anterior application, and I have the patient take a deep breath, and I follow the rib in its physiologic inhalation phase, pump handle, exhalation phase, pump handle. Now, and moving backwards for that elevated test, which is the non-physiologic movement test, you can see the MCPs would be placed about here and here on the first rib, and you would just spring across it, or if you were using your thumbs, you would place your thumbs approximately at this area here and push there and there. And notice that I'm not out anterior in this region at all, because the brachial plexus is going to come through this region, and if I start pushing in the anterior aspects, we can irritate the brachial plexus. So you want to stay just on that posterior aspect of that rib, just as it articulates off that transverse process.